Howdy, my name is Taylor Summers, and this is going to be a speech about the loneliness epidemic. In 2024, the CDC wrote an article that linked the loneliness epidemic and how it impacts young, low-income adults. And within this article, they shared shocking statistics, such as 1 in 3 adults will experience loneliness at some point in their lifetime. Now, a lot of people presume that loneliness isn't something that needs to be confronted head on because it's an emotional feeling that can't hurt you. However, this is incorrect because loneliness has been directly linked to bad mental, emotional, and even physical health, with direct links to physical disabilities that we'll get into later. With this being said, this speech aims to teach low-income young adults how the loneliness epidemic impacts them and the methods in order to negate loneliness, such as building community in order to improve mental, emotional, and physical health. In an article published in 2023 by the Public Health Services, they stated that loneliness is extremely deadly, and it is linked to bad mental, physical, and emotional health. In terms of the physical side, loneliness has been directly linked to obesity, heart defects, diabetes, and can even be an early predictor to death. On the mental health side, loneliness has been linked to increased symptoms and anxiety, PTSD, and even depression, and is directly linked to suicide and self-harm. So as we have heard, loneliness is extremely deadly, and it can impact not only your emotional, but your physical health. So it is a problem that needs to be confronted. However, why do we feel lonely? Why do so many, 1 in 3 people feel lonely at some point in their life? With social media and technology such as phones, where in a click of a button, I can talk to somebody a world away, why do we feel lonely? Well, according to the NIH, people feel lonely, low-income young adults feel lonely because they simply don't have time to spend with their community. When you're spending so much time working and you already have predispositioned anxiety over money, bills, insurance, and more, it's hard to develop a community. However, if we want to prioritize our mental health, we have to prioritize our community because it is a key aspect to good mental health. So how do we do it? How do we get a community out of nowhere? Well, the NIH suggests that in order to build a community, you need to develop hobbies, such as joining a book club, doing self-skincare, riding a bike, going hiking, going sightseeing, even going to the beach or learning a new skill such as cooking. In addition, they also suggest, the NIH, to spend time in community service because working in either a food bank or a hospital can increase self-esteem and confidence, and those two things, confidence and self-esteem, directly negate loneliness. They also suggest spending time with family and friends, because when you have a community that truly loves you and truly supports you, that can directly negate the symptoms of loneliness. So all in all, we have learned that loneliness is extremely deadly. It has direct impacts on mental, physical, and emotional health. And while we do understand that building a community is hard, especially when you don't have time in order to do so, if you want to prioritize your physical and mental health, you have to prioritize community. So all in all, in order to improve physical and emotional health, especially in low-income young adults, community needs to be prioritized through methods such as building a hobby, adding to your community, and choosing a correct support system. Thanks.